Gainesville, Florida Community Analysis by Rocco Bolsch, St. Petersburg College. The first inhabitants of Gainesville were Native Americans 10,000 years ago. Early explorers arrived in the 16th century. The railroad then came through in the 1850s, which brought an American early settlement. The county seat of Gainesville was established in 1856. During the late 1800s, citrus and cattle were the major industry. The University of Florida opened in 1906, in which the major industry switched to cotton, celery, and tomatoes. Post-World War II economy saw Gainesville grow steadily to the size it is today. Here we have an aerial view of present-day Gainesville, and also an aerial view of the University of Florida. The University of Florida is the fourth largest university in the country. Gainesville has a total population of over 100,000 people. Major employers pictured here are Shands Hospital. Houses in Gainesville range from single-family dwellings to multi-family dwellings. As noted from the windshield survey, the conditions of the houses generally depend on the specific area of the city. A quick Google search revealed over 150 places of worship within the city of Gainesville. Gainesville has the RTS bus system. This bus system serves all locations of Gainesville. There are 3 taxi services in Gainesville, not including Uber. The MV shuttle service provides transportation for disabled citizens, Medicaid recipients, and the transportation disadvantaged at a discount rate. Gainesville has easily accessible supermarkets, food banks, thrift stores, and general stores, with multiple stores being open 24 hours a day. One issue the community members see related to the structure of the community is housing the homeless. The majority of the population of Gainesville is between the age of 0 and 29 years. There is a broad scope of ethnic diversity within the population of Gainesville. The unemployment rate is 5.4%, and poverty affects around 11% of the population. Common health concerns within a community include hypertension, cancer, obesity, and heart disease. The city of Gainesville has over a dozen pharmacies, with 2 of them being open 24 hours. The city also has 2 hospitals, one being Shands at University of Florida. This facility is an 850-bed tertiary care facility with a level 1 trauma designation. The other hospital is North Florida Regional. Gainesville has multiple skilled nursing facilities and 2 behavioral health care facilities. Based on my findings in the community assessment assignment, the availability of health resources includes multiple barriers. One barrier is accessibility. A goal would be to improve the access to health care to prevent disease, with the rationale of getting patients into healthcare systems to help prevent disease. Another barrier for healthcare is acceptability. A goal would be to improve services through the use of a primary care provider, with the rationale of having the patient be more acceptable of the healthcare through trust built by the primary care provider. Finally, another barrier is affordability, with the goal of decreasing the lack of adequate coverage. The rationale is not everyone has health insurance, or good health insurance for that matter, and healthcare can be expensive. Thank you. The city of Gainesville is in charge of their water supply, as well as their sewer processing water treatment facility. The city has multiple parks and recreational opportunities. and has a disaster plan implemented on their city website. Based on my findings in the community assessment assignment, the adequacy of environmental resources within the community are adequate, although the vague disaster planning could use some revamping under emergency preparedness. Also, during football games, traffic becomes an issue, especially when I'm trying to get to the hospital for an emergency procedure. The City of Gainesville has a council and management form of government, which means the mayor and the commissioners make decisions, and the city manager and staff implement the decisions. Their functions are to perform duties such as setting the budget and passing ordinances and regulations. Based on my findings in the community assessment assignment, the economic and political function of the community is as such. The community officials are easily accessible, with their emails being posted on the city website. The community meetings aren't very well attended, although I did only attend one. There was only one other member outside of the public officials in attendance. One area of concern is economic. The fiscal budget has some shortfalls where public programs such as the street sweeping program is in jeopardy of being cut or privatized. My 6 prioritized community needs are as follows. 1. The community need for education of healthy lifestyle choices related to population data of overweight, poor diet, and exercise within the community of Gainesville. My rationale behind this is this primary prevention of doing proper exercise and diet will help increase health. Second, community need of decreasing poverty related to the 11.9% of population living below the poverty level here in Gainesville. People living in poverty are more likely to have health issues. My third prioritized community need is to decrease the community unemployment rate related to unemployment rate of 5.4%. My rationale behind this is that being unemployed, you're less likely to use health services. My fourth prioritized community need is to provide an adequate financial budget for the fiscal year related to the current community budget concerns. My fifth prioritized community need is to provide education on health concerns related to the common concerns in the community, as previously discussed, being hypertension, cancer, heart disease, and obesity. My final prioritized community need is to increase the detail of the disaster planning related to the lack of detail in which the emergency preparedness plan has on the City of Gainesville website. This is only for safety reasons. In case there is an emergency, we would like to be prepared in the safest way possible to evacuate. The community needs were prioritized based on the health of the community and 1, preventing disease and illness, all the way to modifying healthcare choices, and finally ending with reacting to possible disaster. Finally, we come to the global community issue. Again, it relates to my number 1 priority, lifestyle choices. This is a leading cause of disability worldwide. Global health concerns are not limited to just infectious diseases. Non-communicable diseases, such as these lifestyle conditions, are among the leading cause of disability worldwide. These conditions can be related to diabetes and obesity, heart disease, high blood pressure, and even cancer. One intervention to help prevent these issues education. The community nurse plays a vital role in these issues, and his or her role can be that of educating the public